I'm Grace Thompson and I became a registered music therapist in Melbourne, Australia in 1994. Back then, as a 22-year-old new graduate, the only real professional experience I had interacting with parents was as a studio music teacher. In those early music therapy days, I remember feeling quite nervous leading sessions with preschool-aged children with disabilities and their parents in the room. I didn't have children of my own and I just felt so young. Later, when I did have my own children, I expected to feel a little more comfortable interacting with parents, and I did. However, our life experiences were really vastly different. Around the same time, at the end of the 1990s, early 2000s, attitudes towards therapy were rapidly changing, and co-facilitating sessions with other professionals was encouraged in the special education system. Working with either parents or other professionals raised similar issues for me in terms of how I could make music therapy methods and approaches accessible and manageable for non-music therapists to facilitate with children with disabilities. Research informed by systems theory, sometimes called an ecological approach, challenged the benefits of traditional therapist-child sessions that could only be funded to run once a week or even once a fortnight with children and young people with disability. Researching and reflecting on the benefits of incorporating ecological systems theory into music therapy practice has now become the focus of my work. With its emphasis on supporting social interactions in the community and closer interpersonal relationships between caregivers and children, an ecologically oriented approach is particularly useful in supporting the health and well-being of children and young people with neurodevelopmental conditions such as autism. I hope you find the information in this tutorial helpful to developing your own practice. In this tutorial, I'll firstly take you through some background information about the autism spectrum and theories of how to support social communication development. Next, I'll explain how ecologically oriented theories inform my work in this area and present a way to approach program planning from assessment through to intense therapist support, through to consultation and collaboration with other caregivers and professionals. I'll then provide a detailed case example to highlight some of the key concepts described. And then finally, I'll introduce an assessment tool for engaging with parents called the Music in Everyday Life, or MEL, assessment. So why is all of this important? Well, ecologically oriented approaches such as family-centred practice and consultative professional models are transforming the more traditional segregated therapy methods. The benefit is that children's everyday learning environments can be leveraged to provide rich developmental opportunities with music throughout the day, so that these developmental opportunities are not just confined to a weekly or even fortnightly music therapy session. Along with this, research has shown that there are benefits to caregivers and professionals who collaborate in music therapy sessions, such as closer relationships with the child, greater understanding of how to incorporate the child's interests into their learning, and personal relief from their own pressures through participating in a mutually enjoyable activity such as music. And so, ecological orientations to practice are also a sustainable therapy model, and that fits with a philosophy of community inclusion and participation. Understanding how to plan music therapy programs that progress from assessment through to intense therapist support, through to consultation and collaboration with other caregivers and professionals, is becoming increasingly popular in countries adopting rights-based models of therapy, such as Australia. The learning objectives for this tutorial are, firstly, to expand your understanding of the autism spectrum and the key theories informing music therapy practice, and also to develop your knowledge of different ways to support social communication development in children on the autism spectrum in music therapy practice, such as by including the family and other professionals, and the implications this creates for planning music therapy methods. And then at a more advanced level, you will be invited to critically reflect on the relevance of ecologically oriented music therapy approaches in your own practice. And also to develop your skills in adapting music therapy methods to promote participation from parents and other professionals. Finally, you'll be asked to develop your understanding of the Music in Everyday Life assessment tool and how it can support your work with families.